The doctor is in. How are you? This is Ricky Fairley, and Dr. Mo will be here momentarily. Of course, she's running from surgery, probably jumping out of her scrubs, and there she is on cue, on cue. But we're going to have a great show today, and we have two amazing guests. Hey, Mo, she's coming.
Hey, 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 here we are.
Here we are.
Oh my goodness, look at all these beautiful faces. The doctor is in. I made it.
I know you made it. You made it. You made it. But yeah, we have two amazing, amazing guests. And Wendy, Dr. Wendy, is our newest member of our medical advisory board. I scooped her up, and I found this. We met Alex Stone, Wendy, right? And he's been such a good friend. He heads up the Oncology Nurses Coalition. Is that right? And he said, I have these amazing Black nurses for you. And here's all their email addresses. So I sent this mass email about, and she was the first one to answer. It's like, I want to be your friend. And so I said, well, be my friend. And so I scooped her up. And then after like 5 minutes, I said, you have to be on our medical advisory board. We need oncology nurses on our medical advisory board, right? So I scooped her up and I said, we had a great conversation, and we're going to talk about a silent killer, the EQ around stress. And she named this episode, so this is her show. And then I said, well, do you have a patient that wants to talk about this? And so she brought her along, our Tasha, and she's a TNBC breastie. So I'm gonna, let's jump right in, Mo. Mo, first you gotta see my umbrella.
I see your parasol. Yes, because what you all may or may not know until the show airs, that we turned New Orleans pink. I mean, we turned it pink upside down, all around the French Quarter, the French Market, the Essence Festival, all of it. And it was the
Mayor's Ball.
The Mayor's Ball. It was everything it needed to be and more. The only thing that was missing was all of you. So we look forward to seeing you guys next year. But this show is near and dear to my heart, as are oncology nurses, because the work that you all do is truly God's work. And everybody who's been a patient knows that when the doctor leaves a room, no matter how thorough, I could spend an hour and a half. Where the work gets done is between the patient and that oncology nurse. The conversations, okay, let me break this down for you. I know you heard it, but did you understand what it means? Okay, so what do you actually do next? Okay, so where are you going? How are you doing? Do you have food? Do you have gas? Like all the things. And life doesn't stop just because a cancer diagnosis happens. It's like, oh, I'm getting divorced and cancer. Oh, I have diabetes and cancer. Oh, wait, my kids are doing what? Doing drugs and cancer. And life is really real. And so it's so important to talk about this episode of stress. Dr. Wendy, I'm going to let you talk, tell your story, tell us your why. Tarsha, welcome. We are so happy to see you. And we're just going to let you guys talk about it.
Yeah, go for it.
Welcome to the board. Welcome to the show.
Thank you. Thank you so much for having us. I really appreciate it. This is such an important topic, and it is near and dear to my heart. So my name is Wendy Garvin Mayo. I am a nurse practitioner. I'm a stress solution strategist. I'm also an EQ specialist. And the reason stress is so important, because as a Black community, we don't talk about it enough. We actually wear it as a badge of honor. And I like to just start by asking, who taught you about stress? We don't talk about stress at the table. We don't talk about stress, to our kids, to our spouse. And sometimes like, oh, I'm so stressed. And that's it. We keep it moving. But stress is a serious phenomenon, meaning it's a lived experience, meaning your definition of stress will be different from my definition of stress, but it's going to manifest in our bodies the same way. And stress, like the title says, can be a silent killer if we don't manage it, if we don't take it serious. So I use EQ essentially as a practice, which we'll talk about throughout this segment, as a way to manage stress. So EQ is really just being aware of our emotions, the emotions of others, and using that awareness to manage ourselves and manage relationships. That's what it's about. And sometimes, when we have things going on in our lives, we feel out of control. We feel like we don't have the control to manage, or the capacity, as I like to say, to manage situations or people, right?
I love what you said. I love what you said, that we wear stress like a badge of honor. Right? That's scary. And we do, right? And we almost become martyrs of it too. You know, how many people do know, like, oh, I'm so stressed out, but I got to do these 40 things. And they, what can I help you know?
Right.
I think everybody's under a measure of stress, but what's that tipping point where stress becomes toxic and becomes illness and can lead to other things? Because I feel like we're all walking around with a little ball of knots at some point in our day, in our week, in our life. Like, you know, how do we differentiate average stress versus toxic stress?
Yeah, so I wanted to say that stress is a good thing. It's a mechanism where our body revs up to protect us. That's the acute stress response. So if you see a dog and it's chasing you, your body revs up. That's a stress response. That's great. It starts to become a problem when it's chronic. And how we would know that is when our lives start shifting, when we feel out of control, when we feel like we don't know what to do. We feel like our capacity is full. There's nowhere else to go. And what happens is when that happens, we feel like we don't have an outlet, right? So we don't talk about it. We kind of keep it to ourselves. We don't, we poo-poo self-care. We poo-poo, talking to a psychologist or social worker or talking to our family. But it's when your life, and we all know when our life shifts. We know when it shifts. And if you don't know, what I would challenge you to do is just take some time, schedule some time to yourself and just think about, where am I right now in life? And where do I want to be in all aspects of our lives, right? So that's when we know that it's chronic, when things are shifting or you just feel like you're not in control. And we all should have some control over our lives, right? So that's when we know we're kind of in trouble, when we kind of deviate and it's like things are not quite right.
But you know what? I don't know. And I definitely believe my breast cancer was caused by stress. And I didn't realize it. I didn't believe in stress. Like, I don't believe in stress. It's for women, it's a cop out, right? And I think I just internalized everything. But when it's your normal, when this crazy life is your normal, it's hard to step above that and see what you're in, right? Until you get out of it. Like, it was my normal. And I didn't have control over my life. I was the breadwinner for my family, the rainmaker for my company, but I didn't feel like I had the choice to do something else. Does that make sense? I felt trapped in this situation where I had to do the things I had to do at my own personal expense, but I didn't feel like I had the option to opt out of it and make a choice out of it. Does that make sense?
Yes.
Yes. Go ahead,
Okay.
Tasha. You want to say something to that?
I was gonna agree with Ricky. That's exactly where I was. I definitely do agree that my stress had a lot to do with, I think, the aggression of the second time my cancer came back and how big it grew at the beginning. And I was so thankful for Wendy with going over the EQ and giving me strategies and things so that I can determine like what is more important and what can I actually carry and what do I need to actually put down, and my life actually depended on it. So I would definitely say that going through the stress, like stress can definitely be a silent killer if we don't watch out, like not just breast cancer but anything, diabetes, strokes, heart disease, anything.
So go back and tell your story, Tasha. We didn't let you tell your story.
Oh yeah. So I am a second breast cancer survivor. The first time in 2020, I was diagnosed with a DCIS, which is at a stage 0, very small. I had a small lumpectomy and I had the radiation. A year later, during that time, I was under a lot of stress. I was transitioning into becoming a special education teacher while in school. Like you said, the breadwinner of my family, starting my own things on the side. And I was doing everything, like Wendy said, wearing that stress like a badge of honor, not wanting to look for help from anyone. And I tell you, God will humble you to get to, humble yourself and just receive that help, and trying to do it all. And literally when I went up for my follow-up, I was diagnosed with a more aggressive form, which was the H2.
Triple negative.
Triple negative, yes, the HER. So I was diagnosed with that and was told that it was definitely more aggressive, and I had to go through with chemotherapy. I'm thankful I had 12. I was supposed to do 12 rounds of chemo, but I ended up only needing 9. The tumor shrunk drastically, which I was so thankful for. And I ended up having I just recently had a mastectomy on June 2nd. So I'm recovering from
God bless
that right now.
you. God bless you.
Yeah, so I'm so thankful to be here, to be able to share this story. And I said that I will use every breath in my body to be able to advocate for everyone and let them know how important, male or female, how important it is to get yourself checked out and get those exams, whether you're a female with breast cancer or a male with prostate. I was just talking to my son about
Uh-oh, lost her for a minute.
Oh,
She raises a good point though, because it's not just a silent killer for women, right? So the impact of stress on the bodies of men who are taught from an early age as well to internalize, to not show any signs of weakness, to they don't have even some of the same outlets that women have, even though we may not choose to use them as often. I think we have a little bit of license when we're younger to show our emotions, but as we get older, especially as Black women, right, it becomes like you said, Wendy, that badge of honor to be the strong. When people come up and say you're so strong, or you did a great job in that meeting, it's so strong, to your voice is so powerful, and they like to label Black women a lot with these adjectives that we think are badges of honor. But I would dare say that it creates a level of expectation and puts a level of pressure and more stress on us.
yeah. And, when I think about just managing stress, I think about identity, because it's who we are, who we truly are, who we think we are, and who people perceive us to be. And many times those 3 identities are in conflict. And even talking about men and women, even the label, you feel like you have to live up to that label. You feel like you have to live up to being tough, not showing emotion. And I think a diagnosis of breast cancer specifically, it shifts that. It shifts that identity. Like you were saying, Ricky, you're the breadwinner, right? How can you give that up? How can you sway away from that to kind of get what you want? So it's kind of, you're in conflict with identity. And then we let people label us, and we kind of keep that on our shoulders. Like, oh no, I don't want that. I don't want to be strong today.
Sure.
Say those 3 things again. Say those 3 things again, Wendy. The 3 identities.
Yep. Who you are, who you think you are, and who people perceive you to be.
Ooh, wait.
Oh, say that
That's
again.
loaded. That's
Say that,
loaded,
say
isn't
that
it?
again. I'm trying to deal with it. Who you are.
Who you are, who you perceive yourself to be, so your self-perception, and then who others perceive you to be, the people around you. And those 3 identities can be in conflict.
That's a lot. Yes.
And that can cause stress because you're not living up to your own expectations. You're not living up to the expectations of people around you. But it's like, who are you truly? And as humans, we are not one way. Depending on the situation, we may shift. We do have values now. We have values. Those won't change. But depending on the situation, things may shift or sway, and we have to be okay with that. I always call it emotional agility.
Yeah.
Emotional agility is so important.
It is.
But being able to verbalize that to the people in your ecosystem.
Is there an exercise that you invite patients to do? Like, how do we reconcile these things? Because I think that we go through life so much projecting who we think we are that we don't really stop to see how we're perceived and who we are in the eyes of others. But also who are we to ourselves? You know what I mean? Like, how do you reconcile these 3 things? Is there like an exercise that you invite people to do?
Yes. I always tell people, write a letter to yourself, introducing yourself to yourself without using titles. Who are you? Who are you? What do you want?
Oh, I love
Don't
this.
you want?
Right.
And really honoring that. And I also have people think about, where am I now? Where do I want to be? And what is the next best step to take towards that? And honoring that. It's really about honoring self. We know what we want. We know what we need, but we don't always honor that.
Wow.
I'm trying to write this down.
I want to keep going with Tasha, with your story. Can you talk to us a little bit about some of the stressors and how you were able to maybe identify and begin to start to come up with ways to manage some of those stressors, because it can feel overwhelming when you're facing a diagnosis of breast cancer, especially for the second time. Like, how do you start to put the pieces in their proper perspective?
First, stopping. Something that Wendy has me do, where she always said, "Can I do the stop? Can I share the stop?"
Oh, yeah, absolutely.
Yeah.
Absolutely.
She would have me stop, think about, the things that I can control, the things that I can't, my options, and then proceed. So in the midst of stopping, I like writing down and prioritizing what I needed to handle and what needed to go first. And then thinking about my options and, if I didn't do this, what would happen here? And then proceeding. And I would say I'm blessed because my children are older. So I didn't really have the stress of dealing with the young children, which my heart goes out to moms who have young children. But me being a special education kindergarten teacher, I still work during my chemo. With the grace of God, I was able to still do my chemo during this pandemic, go in every day and still finish my teaching program. But it was also a matter of prioritizing too, like, okay, I want to hang with family and friends, but I know that Friday, Saturday, Sunday, I need to rest because I'm getting my chemo. And so it's like little things like that, and prioritizing, learning to just say, when my children don't do the dishes, learning to just say, oh, well, and not going crazy over a couple of dishes in the sink, so just learning to pick and choose my battles. And I would say my faith definitely played a huge role in like dealing with my stresses, because I had to realize that God didn't bring me to this point just to leave me. And I had to literally keep telling myself that over and over again, because there was so many times where I'm just like, there was so many bumps in the road. Like Wendy will tell you that I went through, caught COVID twice and everything, but I was able to still manage. So I'm like, I know God didn't get me here for no reason. It was just another testimony that I'm going to be able to use to glorify his name. So I had to really keep my faith to remind myself, like, you're going to get through this, you're going to get through this. So I would say definitely prioritizing and learning to know what to pick up and what to sit down was a real huge thing in my faith. And surrounding yourself too. The people you have in your space is very important as well. And it plays a huge role on the stress that you carry. And I never noticed that as well. And sometimes we love our family so much, but sometimes some family members, you're like, I'm gonna need you to give me space while I go through this. And a lot of my family was upset because the second time around, the first time I was an open book. The second time around, I wanted to keep it to myself because I knew I had to protect my mental and my own faith. Right, exactly. And it was very crucial for me to pay attention to who I had in my space.
Wendy, let me ask you, I heard her say I had to stop and take stock. Is that the same thing as mindfulness? Because we read and hear a lot about mindfulness now. Is that one of the techniques that I guess people can employ? Because, it's kind of a buzzword right now.
Yeah. So what Tasha was alluding to is the stop method that I use with individuals who I work with. So it's really just stopping, thinking. It's really taking back control, because sometimes we're just reactive. It's a moment to just reflect. And I guess it is a time of mindfulness. Mindfulness just means being in the present. Many times when we're stressing, it's usually about something that hasn't happened yet or something that already happened. So mindfulness is really just being in the moment with self, being aligned. So that is a stop method. It is a way to really do that and reevaluate what's happening. I do want to add, Tosh, you didn't say this, but I was very impressed. I am very impressed and so proud of Tosh. So Tosh and I knew each other since middle school, 6th grade.
Oh, wow.
So she's my sister. So, you know, when she was diagnosed the second time, she has just her creativity. And I'm not going to cry, but like just becoming an author, podcasting, all these things that she would never do, always say she can't do, just tap into those and like just sharing her gifts with the world, like unapologetically. Like it's amazing. Like just the creativity that you were able to tap into that, you know, you always said, I wouldn't do that, or I can't do that. But this like gave you that push to just blossom.
Right. This that was another stress reliever for me, I think. And I would say that's part of the stress management is you know, with us living our authentic selves, like you said. And I would always feel like no one would want to hear from me. No one would want, you know, and I would hold that in. But there was something in me that always wanted to, you know, be able to speak and help others. But that inner critic would always tell me no, and I would always put it off. And I wrote like a couple of children's books, and I just had them sitting in my Google Doc. And when this happened, I remember December, actually, I had my grandson in the bed with me, and I was crying. I was like, okay, God, if you want me to, if this is it, then this is it. I accept your will. But if it's not, I'm gonna do what you tell me to do. And I remember crying, I got on my knees, prayed, cried, and then I just got up, got in my bed and just started typing. And I wrote another book. And this one was more towards, it's called Graham's Jam and His Healing Love. So it's my grandson. It's about my grandson and how he helped me during my cancer journey, and how our love and that bond helped you know, strengthen me during that journey. So that's one of the things. And I started a podcast that I'm in the works right now of getting together, and it's called Not Today Alice, which is that inner critic that I named in my head whenever I'm like, no, you can't do it. I'm like, not today, Alice. I'm not going down that rabbit hole with you today. So
I love it.
That's the podcast.
You say grandson.
I was about to say, we know black doesn't crack, but
come on, you got to be kidding.
No, how can you be a grandmother?
Yes, he just turned 1, and he actually just walked yesterday. So that just like,
oh wow,
he's actually downstairs, and I can hear him like laughing, and I'm all the way upstairs. And so yes,
wow. You started young, girl. You started young.
Yes, and you know, and I always tell people, that's another one of my stories that I use to share, because I started working with teen girls, and it's another story. And I've helped a lot of mothers who had daughters who had their kids young, and I used to feel ashamed of that. That was one of my like, oh, I had my kids young, but I never stopped going to school, never stopped doing what I had to do. But when I look at where I'm at now, I'm like, it was all God's design, because I've had fibroid surgery with a fibroid the size of a 4-month-old embryo. And I had breast cancer twice, and these are all in my 30s. And this is the time where a lot of people are starting to have kids. So it's like God knew where he was taking me before I even knew. And I was actually in school for nursing. I wanted to become a cardiac nurse practitioner, and I used to do that, and decided to switch over to work with children with autism. So, and I know if my kids were younger, I wouldn't be able to do that. So it's like, it's definitely a divine. So once I realized that my life was literally sketched out for me and how it was supposed to be, it's like, it's easy to walk in it and not feel ashamed or anything of that. So yes.
What about people who are agnostic and atheists? How do we help them to unpack some of this as well? Because I think our faith for many of us is a pillar of how we're able to conceptualize and get through and use this you know, this moment, this test as a testimony, but for individuals who maybe are agnostic, how do we approach that a little bit differently, or do we approach it differently?
So when you talk about agnostic, I think it's really the same. It's about self.
Mhm.
It's really about self, us as individuals. So some people have faith, some people don't, right? But you're still going to honor self. What do you need? And that's not going to change regardless, you know, of your religious or religious beliefs. So I think it really is the same. And I want to just make a point to what Tosh, I call her, said about tapping into her ability. So I truly believe one thing that drives me to do my work is that when we can manage stress or have perspective on stress, we can tap into our gifts. Everyone who can hear my voice has a gift.
Right.
And we shouldn't have to wait for something to happen or wait till next year or wait until tap into your gift now.
I love that.
Tap into your gifts now. Everyone has a gift. And, you know, if we can really understand what our stresses are, how to manage them, we can really align with that, align with our purpose. Don't get me started on purpose, but I truly in my heart, I know and I believe that.
Oh, talk about purpose. We got time
Talk
today.
about purpose. Yeah, I know cancer gave me my purpose. How do you talk about purpose?
Yeah, so your purpose is what you're here for. And the way I describe it is what lights you up. You know, that thing, that intangible feeling you get, or that intangible thing. And usually your purpose, it's for you, but it's benefiting the world. It's legacy. I attach legacy to purpose, just me. But you
don't know. What if you don't know?
If you don't know, what are your goals? Because purpose is a big thing, but what are your goals? What do you like? What do you like to do? What feeds your soul?
Mhm.
And we have to stop and think about that. But I think about, like, when we're stressed, it really suppresses that. You can't even think at that level because you're just so preoccupied with the stressors in your life. So purpose is so important, and it leads to how we live our lives now. Where are we working? Who are we working for? What are we doing? Is it aligning with our purpose? Is it feeding us? Is it depleting us, right? Who's in our life? Because all those things impact, you know, our alignment with purpose.
Yeah.
Interesting you say that, and it kind of goes back to, like, when you're stuck, like, how do you get unstuck? Like, I was stuck. I didn't know my purpose. Breast cancer gave me my purpose. You know, I would have loved to have gotten it a different way, but I thank God for it gave me my purpose. But think about people who are stuck because they have 3 kids. They're a single mom. I'm a single mom. I got 3 kids. I got to go to work. I'm trying to make ends meet. I'm just trying to get through the day. And I have a stressful job. I have a stressful household. I'm just trying to get through my day. And now I got cancer. Are you kidding?
Yeah.
You know, that's what we hear every day. Like, if I can just make it to Friday so I can have a weekend, you know, like, how do I get through this? How do I find peace?
Yeah.
I wonder if we could go over those questions again, because I think you're right, Ricky.
Yeah.
There's a lot of folks who they just work a job. They don't necessarily have a career or
Right.
something that guides them that they feel fulfilled about every day. They might just have a job they can't wait to leave every day.
Right.
And they, you know, they go home or they go to their church or they do their activities, but having that true sense of why am I here in the universe is a difficult thing for some folks to come by.
Yeah.
And I wonder if we could maybe just give a few tips or a few leading questions or, you know, for people to begin to unravel that.
Yes. So it's really understanding what feeds you. And I totally can understand that people are working jobs that they probably can't leave, right? But boundaries, how do you create boundaries around that? So yes, I have to work. My mother worked 2 jobs, you know, 7 a.m. to 11 p.m. because she didn't have a choice. But how do you create boundaries around that? So yes, I have to do that 3 days a week or 5 days a week, but on the weekends are mine, right? To tap into what I love, what feeds me, what's going to refuel you for Monday, right? How can you bring what you love to your place of employment, right? Interacting with people. And it's not like big grand things. It can be really small things. It can be minute. It can be praying for someone. It can be just saying, I'm going to have a positive attitude. I'm happy. Just saying good morning. Really just what feeds your soul, what makes you happy.
Right.
It doesn't have to be anything grand. It doesn't have to be $1 million business. It could be just gratitude.
Mhm.
It very little things. And Ricky, to your point of feeling stuck, you know, I think it's important for all of us to ask for help.
Yes.
That's really
It's
hard.
hard. It's hard. Yes, it's hard.
Really hard. It's
It's
really hard.
hard. It's hard.
Really hard.
That fear of being disappointed or turned down or being told no, or, you know, someone not coming through. And I think when you said about the like finding your purpose, I used to think it was something so big. And then I realized that we overthink sometimes, and it's really something that you've always been good at. Like somebody's a talker, and then you realize that you're always having these little talks with younger people, and that could be your calling, something as simple as that, you know? Or like you said, you enjoy cooking for your family, and then that turns into people starting like little cook shows on YouTube, and you know, just whatever it is that you enjoy doing, like you said, that lights you up, and it's not overthinking it. It's just something very small.
I do think technology has helped people find passions. I love how you brought up YouTube, that there's so many people on YouTube now trying to do their thing and express themselves and start businesses between YouTube and Instagram. So I think that's an outlet. I just think about, you know, it sucks to have breast cancer. Like it helped you find your creative niche, right? But what if you don't have that opportunity? There's so many of us that don't, that are scared and don't have good health care, are worried about the next meal for their kid, or they're worried about even how they're going to pay for their care. And you know, there's so many things that cause stress, even just within breast cancer itself, that we have to deal with, you know, so.
Yeah, and it really goes back to healthcare too, Ricky. So even like, you know, for me being a healthcare provider, I think, and we can't control all healthcare providers, but this is something we have to assess in our patients, especially in oncology.
Mhm.
So really taking time with patients, and, you know, not because we've been doing it for years. I think sometimes some providers are just kind of like, oh, it's just another patient. But, you know, patients that come in with cancer, this is their first time, or it's still impacting them. You get to go home to your family, but we have to really reevaluate why we're in oncology and really help patients who come in, doing a full assessment. Do they have milk and bread at home? What are their stresses? What resources do they need? You know, and health disparities, that's a whole nother thing when we're talking about, you know, Black men and women in healthcare with cancer. But we really have to, at a healthcare level, and I think we're pushing, right? We're trying to make change there, but it's a heavy lift. But I think even what you do, Ricky, is, you know, helping people advocate for themselves, ask the right questions, you know, being change agents, you know, linking up with, you know, your community to have someone help advocate for you, you know?
Yeah, I think you mentioned a good thing earlier too, like we have to ask for help, which is really, really hard, because we do have people like you, Wendy, to help us, you know, and I mean, I definitely had an intimate relationship with my chemo nurse, but I think that that it's just, how do you get over that hurdle of saying, okay, I just can't do it anymore. I have to do XYZ. I can't do it alone. I need some help. And that's what I think we as Black women struggle with.
Right.
You know, like just making that admission to say, I'm going to ask for help. Maybe somebody can help me, because we don't think, I guess we have this illusion that nobody can help us.
Right.
Right? Like, why don't we
Or
ask?
nobody does it like we do. You know what I mean?
Right,
Like
there
we
you
have
go.
to let that thing
So
go,
afraid.
because
There
it's
you
not
go.
that you couldn't do the laundry. It's that, are you going to use the right number of Tide Pods and the right amount of fabric softener? And are you going to add the water softener and the Woolite? Are you going to fold my things away? Are you going to make the chicken the way I would make the chicken? Or are you going to make, you know, that's something that we have to, I think, cancer really does force that. And when I talk to my patients all the time about trying to see the blessing in that. When you realize that something really big happened to you that was out of your control, you're going to try to micromanage everything. And I talk to the families about that and watch for this behavior, because it's a manifestation of trying to control things that are spinning out of control, of feeling that lack of control. But the blessing in that is that, you know what, no matter who seasoned the chicken or who made the potato salad or who folded the laundry and how many Tide Pods they put in, asking for that help and letting people help you is a blessing, because we could teach our families how to show up for us, because they don't know. We don't know how to help because we never asked for help.
Yeah, we never taught them. We never asked them, taught them how to make the chicken.
That is so true. That is so true.
Yeah. We
It's
got
really
a question in the chat. Oh, I'm sorry. Go ahead.
Go ahead.
We can get to that question in a little bit.
No, I'm just saying it's perception, right? That no one can season the chicken, no one can do the laundry. But if you shift or reframe that, like, yes, they may not make it like me, but they can do the chicken. We're still going to eat tonight. We're still going to have clean clothes. So it's really reframing and shape. And it's not easy. And I know we're talking about it like it, but it's not easy. It takes practice. It takes, just having someone, having that outlet, whoever that outlet is, but really having that outlet is important.
Yep. I used to tell my kids, the underwear fairy is off duty today. Every week, every morning, you go to your drawer, you magically open the drawer, and there's panties clean every day, right? There's clean pajamas, there's clean clothes, like every day. It's like I call it the underwear fairy. And, the underwear fairy is on strike. But you know what I mean? Like, to your family, all of these things happen like magic.
Right.
Because we
But
are
somebody
people,
in the chat
right?
said they think it's generational. Do you think that there's a generational component to this inability to ask for help and nobody does it better than me-ness?
Yeah.
Mhm,
Especially with Black women.
mhm.
And then we have this stigma of being strong. And I remember telling Wendy, like, I don't want to be the strong Black woman anymore.
Anymore,
I'm,
right.
I'm vulnerable. I'm a delicate flower. And I actually started saying that to my son when he's like, oh, mommy. And I said, I'm a flower. I need you to talk to me. And I think
I need you to water me. Hello.
Right, exactly. And I think going through this, like you all said, Wendy will tell you, everything you guys said was one of my anxieties. And it's crazy, like, hello, you have cancer, you're about to start chemo, and your anxiety is coming from not being able to mop or do dishes. So that was a huge anxiety for me, especially having a surgery. Like right now, still, I can't do my laundry, or like I have to have my daughter help bathe me because I couldn't reach my back because they have to cut my back as well to remove I had a flap.
The flap, yeah.
Front for the
Yeah.
reconstruction. So a lot of things I can't. And I remember telling Wendy, one day I just started crying like 2 days straight. Like I felt so bad it was a joyful cry, but also it was a humbling moment, because I'm like, the people who don't have this is who my heart goes out to. The people who don't have family, there are people who are literally going through this by themselves.
I know, we hate that.
Anyone to talk to connect with, to give them that positive, outlook, nothing. So I just started crying. Like, imagine going through this with no one. And this has been a very humbling experience for me. And it's
that's why we try to be here, because we don't want anyone to fight this fight alone, even if we can just talk to you on Zoom, because you can't do it alone. You just can't. It's horrible. It's a horrible place to be,
That brings us to our question from the chat from Facebook. Somebody said, well, how do you set boundaries for people who are always used to saying yes and being, on the church board and this and that and the soccer mom and the underwear fair and everything? How do you set boundaries?
No, it was a complete sentence. No. No, but I think setting boundaries go back to, what do you want? Not what the church want, not what the board director wants. What do you want? Honoring self and saying, what do I have the capacity for? And I don't have the capacity for that right now.
Yeah.
That's
And
it.
I may get it back, but I don't have it right now.
I don't, and not going into justifying. I think we're good at, oh, I can't do that right now because, but then in 2 weeks I can, like, I don't have the capacity for that right now.
It's a really hard one. It's a
It
really
is.
hard one. It's a really
I'm
hard one
feeling
because
guilty too.
if they don't have anyone else to go to, what happens? And you know, my kid's like, are you okay? Are you crazy? Like, is that part of this whole thing? Yeah, I'm crazy. You know, like, what do you mean you're not going to do that? You know, I mean, I think that what do you mean you're going to get divorced right now? Like, maybe you should wait. Maybe what do you mean you're going to move? You're going to sell your house, whatever. But you do have to dig deep inside and be selfish and put that mask on yourself first and say, I am going to say no, and we're all going to be okay. You know, just give me a minute, but I am going to have to say no to this. And it's so hard. That was one of the hardest things that I ever did in my life, was say no to my kids, something my kids wanted.
Yeah, I would say not feeling guilty neither, like you said, removing that guilt, definitely. And like you said, that mask, I use that one a lot, where I have to put my mask on first, or I can't swim, you know, I can't save everyone if I don't get to the land to get the boat first. So
Right.
during my whole treatment, I have to keep telling myself, Tasha, you have to get through this treatment.
Right.
And then I also thought about, like, there were times that, you know, you didn't have people always there to answer things for you, but you were okay. So they will be okay. Like, and just constantly giving myself that talk that, like you said, they will be okay, and removing the guilt and not to feel guilty. That's the main thing I would say.
I ask my patients to consider the fact that when they say yes to things they don't want to do and yes to others, maybe they're saying no to themselves and to some really important things that they need to do for themselves, like rest, right? Like listening to your body, like self-care, like healing, you know, like journaling, and that saying no to yourself. What are the repercussions of that? You know what I mean? Because people don't always think of, oh, I say no to myself. They just think I just keep saying yes, and I'm people. You know, my face will say no, and my mouth will say yes, and I have to sometimes pull it back, because we need to save something for ourselves, you know, as we go through this process, especially, you know, a cancer journey. It is truly a journey, you know?
Yep. I think what happens though is that it gets to the point where you just can't say yes. So your body takes control of the situation, and like that chemo, like, just see you, bye. You are not moving. You are not moving today. Your body is not going to function today. And that's when either all hell breaks loose or people figure it out.
They say your body always wins. It's keeping score and it always wins. But I want to make a point to say that, you know, chronic stress is associated with many things, such as depression, anxiety, substance abuse, high blood pressure, diabetes, impotence, infertility, you know, reducing the function of your immune system. These are things we are doing to ourselves. So when we say yes and we really don't have the capacity, think about that. And on top of that, think about family history. Are we at higher risk, or do we already have these diagnoses, right? Because if we are not okay, whoever they are not okay. So it really is, you know, goes to the point of putting the mask on yourself. But that's where EQ comes in, is really having that self-awareness of who you are, what do you want, and that self-recognition of regulating self, right? And that regulation of, what do I want? Can I honor that? Can I say no? And being aware of other people, like, you could be empathetic, doesn't mean you have to agree, but I understand that you want me to do this, but I'm telling you, I don't have the capacity right now. And not allowing someone else's emotions to dictate your actions.
Yeah.
Right.
So that's where the whole EQ practice and stress management really comes into play. It's important. And another thing that people can do is reintroduce yourself to people. Who do you want to be? Go and reintroduce yourself to people, even the people in your house.
I love it that you said to
Say
do
more
without
about
a
that.
title. It without a title. Yeah.
Like, what do we walk around shaking hands? Are we writing notes? Are we, you know, those people on the Facebook who says, allow myself to introduce
Yeah.
myself.
You don't really know me, but here I
How do
am.
we do it?
Yeah. How do we do that?
Yeah, well, what do you want? What boundaries do you want to set? How do you want people to treat you? Reintroduce yourself to people. And the thing is you can do that as many times as you need to, because we are different depending on what's going on, what day it is, what side of the bed you wake up on, right? And I think it's so hard when we try to like, oh, I'm this way. We're not all this way all the time, but
Right.
reintroduce yourself. How are you feeling today?
Yes.
You know, what are you willing to take on today? What are you not willing to take on today? Right? So that's reintroduce yourself. Try it.
Yes, I've done it. Like, hi, I'm Tasha, and I'm emotional today because my brother was like, "You're so sensitive." I'm like, "Yes, I am very sensitive. I'm going through a lot, and I'm Tasha, and I'm emotional today." So I definitely had to do it because, especially going through the cancer journey, you
Wow.
1 minute you're strong, and then the next minute you're crying, and anything can be a trigger. So yeah.
Love that. Reintroduce yourself.
Yeah.
That question in itself makes you think about, well, who am I? Am I just the mom? Am I just the worker? Am I just the provider? Am I just like, who am I and who do I really want to be? And I mean, I think breast cancer definitely helps you figure that out because there's so much time when you can't move and you can't really, have nothing else to do but think, right? But I don't know that so many of us, we're walking around crazy because we don't know who we are. We just are, we're slaves to doing things, but not being. Somebody gave me a t-shirt a couple years ago, like being is the new doing.
The new doing. Yeah.
Stop doing and start being. Well, that means like, well, who am I?
Yeah.
What am I supposed to be? Who am I? Who am I supposed to be, right? If I'm not the mother or the provider or the caregiver, who am I? And especially when then all of a sudden people have to do for you. Like, what does that mean? And then when you're in there, are you ever going to reverse that? Because you don't know. You don't know when you're getting treatment. Is the treatment going to work? Am I always going to be this? Am I going to always have to be cared for? Are my kids going to have to take care of me? We don't want that as mothers, right? So when you're in there, you're like, and that just depresses you and adds to your stress. Hello, right?
And your body transforming, let's add that in there. When
Right. What is this body? Right. Yeah. Who am I? What is this body I'm living in?
Right. Like there's several times I looked in the mirror and I'm like, I don't even know who I am. Like I don't even recognize the person in the mirror because it's like everything is gone. My fingernails, I'm looking at my hands, the nail color is different, the bed's different. Like it's like you don't even know who you are, so you're going through a lot, like trying to figure out who are you and redefining yourself.
And I think even in this breast cancer journey, there's not one way to be. And I think that that's an important consideration for people also, because not everybody feels like putting on pink boxing gloves. Not everybody even likes pink, not everybody. And I think that social media can make us think there's only one way to do this, to do your breast cancer journey. And that there is not that either, and that you have the latitude to feel how you feel, to share how you choose to share, to express your vulnerability or your strength how you choose to, and not necessarily how others think that you should.
It almost gives you a license to be who you are. What a concept.
Yeah. Tosh, how did you discover who you are? How did you kind of transition, like during your treatment to now, like today, like right now, who you are sitting in front of us? And I know you're still on the journey, but what was that?
I was about to say, I'm literally still on the journey of, like you said, reintroducing myself to myself, not just to people. I would say I'm reintroducing myself to who I am. And I am starting to become unapologetically me, and just walking boldly in everything that makes me, because I realized that, like I said earlier, like everything that I went through, it literally was a stepping stone and a connection to something. So now I think it's making me more into a calmer, kind of going with the flow, because when you go through the breast cancer journey, you, like we were just talking about with that, always feeling like you're in control. And I am one of those where I like manage with my kids, the Virgo in me. But yeah, so
Did a little church.
Right, that could be it.
Yep. I put that finger up in the air because it's
So
true. You know, some signs are more prone to micromanaging than
Right.
others.
Oh
Right.
my God. So it's like literally realizing I'm not in control. Like literally,
Mhm.
I am not in control. It's literally like being a baby and how you have to rely on someone. It's like literally that's how I just tell myself, like, I can say this is how I want it to go, but that doesn't mean it's gonna happen this way. And it's okay if it doesn't. We'll see what happens next. So it's kind of like it changed my perspective definitely a lot, with trying to make everything like this perfection and you got to do it this way and you can't do it unless it's this way, to just, you know what, just go with the flow and just,
Okay, it's okay.
yeah, we'll see what happens. So I would say it definitely, I'm still learning how to redefine myself and figure it out.
Yeah.
I'm
Someone's
a-
asking in the chat, Latasha, do you have a support group or other breast cancer patients or survivors that you talk to that help you maybe?
So, like Dr. Mo said, I was one of those breast cancer people who didn't want to be defined in a certain way. So going into a lot of the breast cancer support groups made me anxious. Like hearing about different stories and things like that. And I felt like I needed to really protect my mind and just focus on where I am. And if there's someone I can support, I would support. But I would say my family has been a huge help. I follow Dr. Chavette. Oh, I think I said her name wrong. But then it's the Pink Baton. I
Mm-hmm.
like that group. I follow that group. So it's probably like 3 groups that I follow, but they're more so like just educating on how to take care of yourself opposed to talking about the journey, because I feel like everyone's journey is different. And if you keep hearing it, for me, if I kept hearing it, it made me feel like I had to do it this way instead of realizing that my journey is my journey. And it's okay to just get the information that I need to help support me along my journey. I hope that answered that.
Yeah, that's great. And we have a support group on the first Saturday of every month. I'm putting it in the comments on Zoom. And you know, like last week we talked about sex, right, Mo? We talk about everything. So we also have a private Facebook group called Touch Talk on Facebook if you want to join that conversation, and we talk about everything. So we try to provide that support as well. But you have to find your tribe.
Yes.
And you know, it's a club that you don't want to be in, but once you're in it, we have unconditional love for each other. I think our Breasty Club. But you have to find your tribe and what makes you comfortable.
Yeah.
That's true. Somebody in the chat also brought up a really good point, you know, which is that even after the treatment is over, right, there's still a process. And it isn't just going through the treatment and, you know, through chemo and recovery and et cetera. But once it's all done, you know, there's still this process. And I want to make sure I get this right. They said there's still a healing process that we have to be careful to guard our rest and our stress. And I want to talk about the stress after there's fewer doctor's appointments, right? Once you reach that point where you're not seeing a doctor every 2 to 3 weeks or every 2 months, you know, maybe you're only going twice a year now. Like, how do we deal with that and manage that stress as well?
Yeah.
Yeah, so I think managing that stress, it's important to find your tribe. I'm a big advocate of mental health services. It's something I refer my patients to. We talk through it all the time because this is something many people have never experienced. So you don't know really, remember the 3 identities? They're in conflict. So, you know, this is something new, so try something new. So if you have that person, that professional who you can talk through things with, because many times, you know, the stress comes from things that are going on in your mind. And I always say what matters is when you're laying down at night, those thoughts, where you can't go to sleep, but really talking through that with someone, a professional who's trained specifically in oncology, in breast cancer, that can really help guide you and just help you sift through those thoughts, because it's real, right? The journey's gone and no one's around but you and your thoughts. What do you do with those thoughts? So where do you put them? So I'm a big advocate for that.
Yeah, I think that it's okay as part of your care team to ask for ask for counseling, And I think that's one thing, Wendy, that an oncology nurse can help you with, is saying, you know what, maybe you need to get some outside counseling, and it's okay. There is no stigma by it. It's almost like, you need the oncologist, you need the surgeon, you need the radiologist, and you need the counselor, and it's okay to make that part of your care. And your regular team, like, my nurse asked me if I want, I'm like, I don't know, is that gonna help my cancer? And yes, it does.
Yes.
Yes.
It's medicine for your mind.
Yes.
It's medicine for your mind. And I always tell
Okay.
people, try it. Don't knock it before you try it. And
Right.
no one has to know what you're doing. You're doing this for yourself. You don't have to go on Facebook and post it. You don't have to talk, but this is something you need, and try it.
That's the other thing. We're in the chat talking about sometimes the stress of social media, right? Like, it's great for connectivity, but it also is this very forward-facing platform where you have to look perfect, you got to act perfect, you got to say all the right things and put the right quotes, and letting some of that go, or sometimes taking a break from things like social media can be a huge way to reduce some of that stress.
Yes, absolutely. Disconnecting is so important. So
we should talk about nutrition too, really quickly. So foods that are foods that stress, foods that de-stress. Let's do it. Quick round robin.
So you want greens, right? You want to stay away from the sugars, right? All that stuff feeds stress, but things that are really going to balance your body. Proteins, away from the junk food, all the oils, all the fried stuff and not saying you can't have it, all in moderation, not saying cold turkey, but really feeding your body what it needs. And the way I always say you can do that is, how do you feel after you eat it? Are you feeling tired? Are you feeling unmotivated? So you want things that really energize you, that feeds you.
I've never heard that sugar feeds stress. I've heard.
Yeah, and caffeine as well.
Yes.
I know a lot of us like our sugar and our caffeine so to keep us going. But yes, those are foods that certainly can, increase the amount of cortisol. They can increase the heart rate, right? Smoking is another one. People think smoking relaxes them and they get that puff and it relaxes, but it actually makes your heart rate accelerate, and it can create anxiety. So it's always a great time to talk about smoking cessation when we're going through a cancer journey, for sure.
Yes, absolutely. Absolutely. So nutrition, sleep, and movement. I'm not going to say exercise, movement. Just move your body. All those things are really good.
Nutrition, sleep, and movement.
Yeah.
Tasha, are you going to say something? You're smiling.
No, I agree. I was just thinking that, when I heard Ricky say dance it, and I was like, yes, that was one of my movements.
I dance every day.
Yes.
Everybody knows that.
Yes.
Yeah.
Every day. I danced already today.
We got a question in the chat. Somebody said, their sister is a recent survivor and it's difficult to for the family members because they don't know what to do or say. Do we have any advice for people who are watching, who are in the support circle, who are trying to figure out how to do and say the right things and maybe not knowing what to do or say?
From my own experience, going through that, because it can be, so from the cancer patient and the family is looking at it like we're all going through it together. And my family actually helped me realize that, because for a long time I'm like, I'm the one I'm the one like me. You stop and you see them crying, or you see them hard to speak about certain things, and you realize like, hey, wait a minute, they're processing this along with you. So I think it's just a mutual understanding to understand that everyone is mentally going through this transition. This is a trauma for everyone, to process like our kids. Like I like to do check-ins with my children because they try to act strong for me. And so I'll go in and I'm like, hey, so how are you feeling? And I'll do one by one, you know, so they don't feel. I'll do check-in with my siblings and my mother and my father just to see how they're feeling. And then I give them the floor to feel open, to be honest about how they're feeling. And then I'm also, the first time I went through it, I was like, strong, Tasha, don't worry, I'm gonna get through it. And then the second time I was exhausted. And I was just like, this is who I am. I'm going to cry. There's gonna be some days where you're going to see me cry, and that's okay.
It's okay.
Yeah, just like being honest with yourselves, allowing yourself to feel, because once again, I think that's another stigma with us Black families, like showing emotion, right? Like it's a bad thing to show emotion. It's a form of weakness. And I started to transform that into showing weakness as a sign of strength, because it shows a strong person to be vulnerable. And that's what I started to let my kids know, that I was weak when I tried to hide it from you all, but I'm stronger now because I'm letting you all in.
Talk about it.
I am human and that it's okay to cry. Even as men, you know, especially like Black men, we don't cry. Like it's okay to cry. Some days I'll just walk up to my son and I'm like, I need a hug, you know, and we'll just hug each other. So it's like those things. And I would say just being honest with each other and allowing each other to feel.
Yeah. I would say, Sumo, I would add, like, just
Sorry.
walk in the house and do something. Don't ask me what I need, because I'm a control freak. You can't do anything that I need. Right? You're never going to cook the chicken the way I do. Don't ask me. Just come in the house and do a load of laundry, cook some chicken, bring my kids some food, just do it. And that's what my friend did. I'm so blessed that I had this group of friends. They never asked me what I need. They never asked me for what help I wanted, because I knew I wouldn't ask for help. So they just showed up. So just show up for your family, show up for your friends, bring some lasagna, bring some chicken, bring some, you know, do a load of laundry, you know, take the kids out, take them away for a minute, you know, take the kids to the park, you know, just do something. That's all because we're never going to be able to tell you what we want.
Right.
So we can't, we're crazy.
And recognize that it's not just during treatment, because after the treatment is over, there's a sense of loneliness, fear, you know, worry. There's lots of emotions that can set in afterwards. And people are like, but you're already done radiation. You should be okay, but you're only on the maintenance bill, but you finished your chemo, but you're, you know, and you're 2 years out, you're whatever. It changes you. And I think that we have to show that, we have to lead with that sort of compassion, because that's the point where I find a lot of people stop giving themselves compassion and they start bending to what other people think they should do and feel, and they go back into that rut, into that cycle again of pleasing other people, because, well, you know, my cancer is done now, right? But it's a lifelong lesson, and I think that you have to, you know, Wendy, let me have you jump in here and talk about that, reinforcing that lesson throughout life, not just throughout your illness or your treatment.
Yeah, I want to kind of address the caregivers too, because there's support out there for caregivers. There are caregiver support groups that can help you work through that, because like you said, Tasha, it impacts everyone. And again, even after your treatment, and I think, you know, for people who have loved ones or friends with cancer, is being empathetic, asking questions, not making assumptions. Have a conversation, open up the conversation, opposed to saying, oh, well, you shouldn't be, or that was 2 years ago or 3 years ago, because you don't know how people are feeling or what they are going through. So I think it's important to inquire and be gentle with people, you know? So I think that is really important, but also, you know, individuals with breast cancer, letting people know too.
I think also
letting them know.
Yeah, I think also don't assume that the things that worked for me, that made me happy before I had cancer, are going to make me happy now.
Right.
I was coaching a family yesterday where the daughter was trying to get the mom to take a walk because she loves to walk, but she's taking chemo. She doesn't feel like walking. And then, well, that's going to make you feel better, but you don't assume that you know what's going to make somebody feel better. And if they can't articulate it to you, it's probably not. going to make them feel better. Like, don't assume that even what worked before for them is going to work now, because it's probably not.
That sounds like time to reintroduce herself.
There we go.
I love it. That's
Yes,
what we should have called
Dr.
this
Stone.
one.
I love that. I love
Mhm.
that. We need to write an article about that, Dr. Wendy. I'm going to call you. We need to put an article about reintroduce yourself.
Yes.
Yes,
You
indeed.
know, yeah, people talk about the new normal. There isn't a new normal. It's just you got to figure out who you are. Right?
And be okay with not being the same person every day.
Right. I love that. I love the 3 people. I'm a Gemini, so that really works for me.
Yeah.
You know?
And I
Yeah.
just wanted to add too, as far as the caregiver, because like connected with my sister and seeing how it impacted my family. For cancer patients that are going through it, like, yes, we are going through it, but also we want the empathy too, but stop to think about what your family is going through too, because
Oh, yeah.
they're definitely affected. Like they don't know whether they're gonna lose you. They don't, like, this is just as mentally
Yes.
impactful to them as it is
Right.
for us, you know, because I realize that, like I said, watching and speaking to my family and realizing that my cancer, me going through it the second time, like my sister's my rock, and she broke down like like I was so mad because she told my mom and them when I told her not to say nothing, and I didn't think about how she felt hearing it from me the second time. I just went to confide in her, and I'm like, hold this secret, not knowing that it was so hard on her, and she had to go and look for that support for herself.
That's
So
deep.
also realizing that, you know, our family that we're looking to be our rock, that they also need that help too. So we're not the only ones who should seek
Right.
mental guidance. Like, I think if your family's going through it and you're a caregiver or you're providing someone close to you, you should seek professional help as well to help you manage and get through while you're trying to be the rock, you know?
I love that. Absolutely.
Wow. 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 Wow, you guys. I guess we're going to have to do a phase 2 of this conversation,
Yes,
Yes, this was great.
a part 2.
absolutely. I think it's so important for people to recognize that these are not separate from, you know, your journey, separate from your disease, separate from your treatment, separate from your conversations with your family, with your healthcare providers. These are all baked into the cake. And just maybe there might be some help and some resources. I know that there are, but we don't ask and we don't receive. And so it's so important for you to take this information, share it with your loved ones, and bring it back to your care team, take it to your therapist, take it to the Lord, but take it to everybody. You know, don't just think that this is only something for the church or only something for, you know, your doctor. This is something that takes a community. And that's what we have here in Touch, and what Ricky's built with Touch Talk. So we'll make sure we put that in the chat as well, that you can be in community and receive some support and find like-minded people, so you can just be who you are in this journey. There's no one way to be.
There's no one way to be. And you know what? You may not even know who you are yet. So it's okay to figure it out. Right.
That's right.
Yeah,
That's right.
definitely.
How can people reach you all to follow you on social media and to thumbs up and ask questions and to interface with you?
Yep. So I'm on all social media channels, Wendy Garvin Mayo. But you can also, I have a gift I would love for everyone to download because it's going to help you with the questions. Go to stressblueprint.com and you'll download the 3 questions to ask when you're stressed. And that is an exercise you can do anytime you're feeling stressed, and you can share it with your family. You can share it with anyone. And that's how you can get in contact with me as well. You can stay in my network that way.
It's stressblueprint.com. I'm putting it in the comments. Great.
Okay.
And I am on Instagram and TikTok as Superhero Spirit.
I love that.
Facebook with Higher Intellectual. And I could be reached on those 2 platforms. I'm just starting my platforms, so bear with me with that one. And
No,
I
that's
just
fine.
Spirit.
not today hours.
Love
Great.
it.
And I can, and you know, can always email me. My email's in the comments. I can find these lovely ladies for you. And
Absolutely.
You're now in our family. You know, we don't let you go once you're in, right, Mo?
Yeah, it's like the mafia. You got people now. So and we will connect you. Anybody who's watching who needs support, we're here for you. And we
Yeah.
have an entire network of providers, of breasties, of folks, therapists, whatever it is that you need through your journey, we're here for you. I'm at Dr. Monique Gary on Instagram, LinkedIn, Facebook, Twitter, all the things. And we hope this has been relatable and reliable and real. It's what we set out to do every Wednesday night on Black Doctor. Thank you to our sponsors. Thank you to you for watching, for sharing. And we'll see you next Wednesday night, 6 p.m. The doctor's in.
The doctor is in. Breasty love.
Thank you, guys.
We got to do our
Thanks
breasty
so much
love.
for being here, and thanks for our sponsors. Thank you, Amgen and Genentech and ASI and all our partners and Merck and all you guys that help us do this work. Thank you so much. Bye.